Hello friends, welcome back to Complete Medical Coding. Today let's discuss a few more evaluation and management questions and guidelines. I think few days before I had taken same E&M questions from 2025. Okay, some practice questions which has been taken from this year, CPC questions. So this is the second part. So hope you understood the previous chapter, the previous video. And if you have any queries, you can always mark me in the comments. And as soon as possible, I'll be getting back to you soon. Okay. So anyway, let's discuss few more guidelines and practice questions from the E&M session. All right. These are the repeated questions. Okay. So moving to the videos. First question. A 57-year-old male was sent by his family physician to a urologist for an office consultation. The patient has had bright red blood in his urine sporadically for the past 3 weeks. The urologist obtains a history from the patient and continues with a physical examination. The urologist recommends a cystoscopy to be scheduled for the following week and discuss the procedure and risk with the patient. The medical decision making is of moderate complexity. Report only the office service. So here we have to report the office visit. So which doctor has consulted this patient as an office visit consultation? Urologist. So here you have to report the urologist service. Okay, because the patient was sent by the family physician to a urologist. And then what does that urologist done? The urologist obtains a history from the patient. Okay, continues with physical examination, and medical decision making is of moderate complexity. Urologist recommends a cystoscopy to be scheduled for the following week. Okay, so that's also advised to be done. Anyway, let's find out the code. What is the first one? First code 99244. Option A 99244. Just open your CPT code book, go to 99244. That is an office consultation. Okay, which requires comprehensive history, comprehensive examination, and MDM is of moderate complexity. Yes, our MDM is also moderate complexity, and here it is appended with modifier 57. What is the use of modifier 57? What is modifier 57 used for? It's an E&M. Modifier 57 will be used in an E&M service performed during the preoperative period. Okay, performed during the preoperative period, which led to the decision to perform a major surgical procedure. Yes, because here the urologist is going to do cystoscopy to be scheduled in the next week. So it means he is going to do cystoscopy, which is a surgical procedure. So prior to surgical procedure, if there is any E&M service carried out, which is related to that surgical procedure, then you have to append it with modifier 57. Okay, so that's why 57 modifier is marked here. All right. Now, that is all about the first option. Now, if you go to option C, again, you will get the same code 99244 with modifier 57 and then 52000. Check what is 52000. See, now we are eliminating some options in order to find out the correct answer. Even though if you get the correct answer, just check the other options as well, because there might be an accurate code. Okay, so 52000 is cystourethropy, but you cannot code it now because the doctor has not yet done the procedure, cystoscopy. He's going to do the procedure, so for that you can't bill it, right? So option C is incorrect. Since that cystoscopy is not carried out, it's not done yet, you can't code it. So option C is incorrect. Now, you can eliminate option C. Now B and D are left. What is option B? 99253. 99253 is the code for inpatient consultation. Since this is not an inpatient consultation, so that's also wrong code. Option D, 99221. 99221 is initial hospital care. That's also a hospital care visit. Initial hospital care. Okay, so this is not an initial hospital care. This is an office visit consultation. So office consultation code is only in 99244. And also whatever is mentioned in the question, which is related to the history examination and MDM, everything is correct. And 57 modifier, which is also correct because the doctor is going to do cystoscopy. So here the correct answer will be option A, 99244. That is the exact code. Okay, 99244 with modifier 57. All right. Now let's move to the second question. Second question. A 2-year-old comes in for an initial wellness child examination. Mom doesn't have the child's immunization record. She states that the child's last shot was when he was 5 months old. The physician orders the immunizations to be given in the office today. Immunization given simultaneously. MMRV, that is the immunization given. Measles, mumps, rubella, varicella. Okay, and what CPT codes are reported. So like that, you will be getting short forms for the immunizations also. So you should be knowing what exactly it is. MMR, MMRV. MMR and chickenpox, that is MMRV. Varicella is chickenpox. MMR, measles, mumps, rubella vaccine. Okay. So let's find out the codes, the answers. What is the first one? 99391. The first, here there is an office visit as well as the immunization which is given. So what is 99391? Let's find out anyway. The answers 99391. Double 99391. 99391 is, see, here there is, here this patient actually comes in for, not for vaccination. If the patient, that you have to be careful while coding. If the patient is coming in directly for taking vaccination, then you should not code for consultation. Even though it is an E&M code or whichever consultation code it is, you should not code if the patient is coming directly for an immunization. Okay, but here in the question it is mentioned the patient has come for an annual physical examination, the wellness child examination. Okay, in that when they came for the wellness child examination, along with that the patient's mom has asked for the immunization, and she lost the immunization record. All the story has mentioned, and then the MMR vaccine is given like that. So in this case, you have to first code for the wellness examination, okay, which is comprehensive, periodic comprehensive preventive medicine, the code. No, you cannot say preventive medicine code. The first one, 99391 is, yeah, 99391 is preventive medicine code. That is what we are finding out, going to find out. The exact preventive medicine code, you have to find the code. Anyway, 99391 is, go and take 99391. That is the periodic comprehensive preventive medicine code. Age younger than 1 year. Here our age is 2-year-old. 99391 code is for age younger than 1 year. Also, this is the code for established patient. Here, the question is nothing mentioned if the patient is established or new patient. It's just mentioned 2-year-old comes for initial. Yeah, this is a new patient because it is mentioned initial wellness child examination. So it is the starting, the first visit, initial examination. So which means it is the first visit. So this should not be an established code. Okay. So option A is wrong. Now if you go to option B, 99202. What is 99202? In such type of questions, you can first find out the E&M code, then go for the vaccination code, because so that you can easily skip some options, some codes. Okay, what is 99202? 99202 is the code for new patient, but it's an office visit code. Office or other outpatient visit code. Okay. Here we need the code for wellness child examination. So that is also wrong. Now, if you go to option C, 99382. 99382 is the code for initial comprehensive preventive medicine. Yes, this is a new patient. Okay, initial comprehensive preventive medicine. Early childhood, age 1 through 4 years. So from age 1 to 4, 99382 is the code. Yes, that is exactly the code what we need. The child is 2-year-old and this is initial comprehensive examination. The other one is 99391 was periodic, the repeated periodic examination. So that is wrong. So 99382 is the one which we need. Just let it be there. We have one more option left. Option D, 99212. Just check that also. Anyway, 99212, that is the starting codes in E&M chapter, which doesn't belong to wellness examination. Okay, so that is also wrong code. What is 99212? That is also office visit code. That is also wrong. So here you got the correct answer as option C. Since the other 3 options are wrong, you can directly mark option C as the correct answer, 99382 with modifier 25. Okay. Why is modifier 25 used? See here there is a rule for appending modifier 25. Okay. You have to use modifier 25 with E&M codes while coding with other chapter codes. So along with E&M code, if you are coding 25, if you are marking like modifier 25 is to be marked along with the E&M codes only along with the other chapter codes. Otherwise, you should not mark 25 modifier. Okay, you should mark it with other chapter codes. Here there are other chapter codes, right? For the vaccination, medicine codes are there, 90471 and 90710. Option C. Let's check what it is. Anyway, on examination, you can directly mark it as C. You don't have to worry about the other codes because other options are wrong. But still here I will just let's just check what it is. 90, of course it's a vaccination code. 90471. 90471 is immunization, that administration code. Okay. Immunization administration includes percutaneous, one vaccine. And then 90710 is MMR vaccine. MMR varicella vaccine, measles, mumps, rubella and varicella MMRV for subcutaneous use. Yes. So the administration code, and then 90471 is the administration code for one vaccine. Here MMRV is the single dose. Of course, it is a measles, mumps, rubella, varicella, 4 different type, but it is given as a single shot, as a booster. That is why a single code is there, 90710. So the administration code also should be 1. You should not code it 4 times. That will be wrong. Okay. See, if you check in option D, 90471, 90472, like additional codes are mentioned for administration. That is wrong. You should not code like that. Always check which vaccine it is and how the vaccine is given. If it is a booster vaccine, it will be mentioned in the code as per the description. Okay. So if it is in a single code, then it means it is given as a single booster dose. Okay. So, as I told you, the correct answer is option C, 99382 with modifier 25 for the initial preventive medicine examination, initial wellness child examination. 90471 for the vaccination administration code, and then 90710 is for the immunization, MMRV, the medicine. Okay. Moving to the third question. A pediatrician is asked to be in the room during the delivery of a baby at risk for complications. The pediatrician is in the room for 45 minutes. The baby is born and is completely healthy, not requiring the services of the pediatrician. What CPT code does the pediatrician report? So usually if it is a normal delivery, usually pediatrician won't be there unless if there are complications. And then if there are complications, of course, the pediatrician will be there in the labor room. And Also during the cesarean delivery, pediatrician will be there. So how will you report the pediatrician service here? Because the pediatrician was there in the room for 45 minutes, but then the baby was born completely healthy and there was no other complications. Nothing, no other procedure was carried out. But the pediatrician spent his 45 minutes over there. So how will you report? How will the pediatrician report his services? That is what the question is. First option, 99222. 99222. Initial hospital care. 99222 is the code for initial hospital care. You cannot say this as the initial hospital care. Okay. What is 99252? 99252 is inpatient consultation code. 99252 inpatient consultation. This is also, see, pediatrician is reporting the service. So pediatrician can't report an inpatient consultation code. That is also wrong. What is 99360 option C? 99360 is, yeah, 99360 is the standby service code. This is the code which we need. Okay. Standby service requiring prolonged attendance each 30 minutes. For example, operative standby, standby for frozen section, for cesarean or high risk delivery, for monitoring EEG, etc. So this is exactly the code that we need, 99360, each 30 minutes. If you see option D, 99360 times 2. But you can't put times 2 because each 30 minutes. If it is 1 hour, of course you can go for option D. Since this is less than an hour, only 45 minutes, you can code only the first 30 minutes code. Okay. So here the correct answer is option C, 99360. Standby service for the first 45 minutes. Okay. Now moving to the fourth question. An established 47-year-old woman is seen today at her doctor's office. She is complaining of being dizzy and feels like the room is spinning. She had palpitations on and off for the past 12 months. She reports chest tightness and dyspnea but denies nausea, edema or arm pain. She drinks 2 cups of coffee per day. Her sister has WPW syndrome, which means Wolfe-Parkinson-White syndrome. Okay. A medically appropriate history and exam are performed. An EKG is ordered. The provider does not document a final diagnosis. What CPT code is reported? So this is direct ENM code. Established, it's mentioned there, established patient. Okay, she's complaining of dizzy and then she had palpitations on and off. Then she had chest tightness and dyspnea. All these were there. Appropriate medical history and examination was performed. EKG is also ordered. So accordingly, you have to find out the answer for the E&M code. Okay, what is the first code? 99203. Let's find all the codes, the description for all the codes. 99203 is a new patient code. Office visit code, but it's the code for new patient. In our question, it's clearly mentioned that this is an established patient. So 99203 is wrong. If you go option C, 99204. 99204 is again a new patient code, which is also wrong. We need the established patient code. So go to options B and D, 99214 and 99213, which will be right. 214 and 213. If you check 213, office same, both are established patient codes, office visit codes. Okay. Expanded problem focus history, expanded problem focused examination, and MDM is of low complexity. And 99214 is detailed history, detailed examination, and MDM is of moderate complexity. Here MDM, here medically appropriate history and exam are performed. Yes, of course, it's an expanded one. And EKG is ordered, which is of low complexity. Okay. Since the MDM is not, even though the MDM is not mentioned as low complexity, from the question you have to identify whether the medical decision making, is it low or high or moderate, whatever it is. Here nothing is, doctor has not done anything serious. I mean anything severe, not, you cannot say serious, anything severe. Of course, doctors are doing everything serious only. But nothing severe is mentioned here. So MDM is of low complexity as only EKG is ordered. Okay. So the correct answer will be, the correct code will be 99213. Answer is option D, 99213. Okay, expanded problem focus history examination and then MDM is of low complexity. Alright. Sometimes you won't get direct questions or directly it won't be mentioned. What is MDM, like that. If there is prescription given or something is given, then it means it will be moderate complexity. It will go from low to medium, moderate or high. Okay, it will change accordingly. Now, anyway, moving to fifth question. A 3-year-old critically ill child is admitted by the same physician to the PICU, pediatric ICU, okay, from the ER with respiratory failure due to an exacerbation of asthma not manageable in the ER emergency room. The physician starts continuous bronchodilator therapy and pharmacologic support along with cardiovascular monitoring and is thinking about the need for possible mechanical ventilation support. The physician documents a comprehensive history and examination, and orders are written after treatment is initiated. After the treatment is initiated, orders are written. So, what is the CPT code for this encounter? Here, this is some different type of question when compared to fourth one. I mean, the description is mentioned only about what is that comprehensive history and examination, and then MDM. From the orders, you have to identify whether the MDM is of low or high complexity. From that, you need to identify. Anyway, let's move directly to the codes, to the options one by one. What is 99291? The first one, 99291 code. 99291 is critical care code, critical care evaluation and management code for critically ill patient, injured patient for first 30 to 74 minutes. This is PICU code. You should be coding PICU code. If you go to option B, 99475. 99475. What is 99475? Go and check 99475. 475 is inpatient. Yeah. 99475 is the code for inpatient pediatric critical care. Pediatric ICU code is 99475. So, initial inpatient pediatric critical care per day for the evaluation and management of a critically ill infant or young child 2 through 5 years of age, from 2 to 5 years. So, this is, since this is 3 year, you can code this one, 99475. What is the options? What are the other options? Let's check other options as well. 99284, and if you see option D, 99476. 476 is subsequent inpatient pediatric critical care. 99475 is initial PICU care, pediatric critical care. 99476 is subsequent pediatric care. The age is mentioned as same, 2 to 5 years. So from this question, you have to identify whether this is initial care or subsequent care. So in the first sentence, see, 3-year-old is admitted by same physician to PICU from the emergency room. So it was the same day from emergency room to the same physician. So this is an initial one. This is not because the asthma was not manageable in the emergency room. So it is shifted to PICU. So first time shifting to PICU. So this means, which means it is an initial pediatric care. Initial pediatric critical care, not the subsequent one. So option D is wrong. Now if you check option C, that is pending for us, 99284. If you check 99284, it is 99284. There is emergency department code 99284. But here, from the emergency room, the patient has been shifted to PICU. So currently the patient is in PICU. So you have to code for the PICU. So 99284 is also, sorry, 284 is also wrong. So the correct answer is option B, 99475 for the initial inpatient pediatric critical care code. Okay, the age from 2 to 5 years. So that's how you have to mark it. Alright. So friends, that's it for today. These are few important E and M questions. Hope you like the video. If you like, please, if you find this video useful, please like and share it among your friends. Those who are new to the channel, please subscribe. Please support me. Please subscribe the channel and please press the bell icon so that you will be getting notifications, as nowadays I am doing regularly with the videos, because now health wise I am all right. So I am trying to put every day or once, like every alternate days, videos for those who are, especially this is 2025, the next year, next calendar year. So I know many of you are preparing for the examinations. So just to help them, I'm putting more and more videos. Okay, so thank you so much, friends. And if you have any queries, Please always mark it in the comments. Thank you so much and stay tuned for more videos. See you in the next episode. Bye. Take care.